Good afternoon, everyone, and welcome to the National Collaborating Center for Healthy Public Policies webinar entitled Sharing Knowledge with the Advisors of Policymakers, a couple of myths, a couple of tips. My name is Mylène Maguire, and I'm here to offer technical support during this webinar. At any time during the webinar, you can ask questions using the chat box. Please note that the PowerPoint presentation, as well as the recording of this webinar, will be available on our website afterwards. We will send you an email with the links. If you are attending the webinar with a few colleagues in a room, please tell us how many are attending with you by telling us through the chat box. Well, thank you, and I wish you a very good webinar. I'll now pass the microphone to my colleague or presenter, Florence Morestin.
Well, hello everyone. Thanks, Mylène, for the introduction. Thanks also to our colleague Michael Keating. He will be helping me handling with the chat today. So we all work at the NCCHPP, which belongs to a network of 6 collaborating centers financed by the Public Health Agency of Canada and located across Canada. And the NCCHPP is hosted by the INSPQ, Quebec's National Public Health Institute, and our mandate is to support public health actors in their efforts to promote healthy public policy, hence the topic of today's webinar. Because this webinar is accredited by University of Montreal School of Public Health, I am obliged to disclose any conflicts of interest I may have and I have known. And with this webinar today, we wish to help you distinguish between various types of advisors of policymakers, assess how relevant it might be to approach these advisors, and refine your strategies for interacting with them. Now, let's clarify who we are talking about. So this webinar deals with the advisors of ministers in ministerial departments, of elected members or senators in the legislative branch, and of mayors and councillors in municipal government. Now, policymakers get policy advice from all kinds of persons. Here today, we focus on professional advisors based within government structures. So that excludes unofficial advisors, the ones based outside of government. And also, we don't consider either professionals in government structures who do not develop public policy. For instance, those who work on organizing service delivery. So from now on, when I talk about advisors, it will refer only to those who produce policy advice. And by the way, this makes them policy advisors even if they don't interact directly with policymakers, okay? What about the knowledge? Because we are talking about knowledge sharing here. Well, providing policy advice involves processing various types of knowledge, and advisors are tasked with doing that. Policymakers don't usually do this processing. So, if one wants to share public health knowledge in the hope of promoting healthier public policy, advisors are an important link in the chain. And just a note here, so you can see in the boxes, conveyor of knowledge, policy advisor. Just, I would like to point the fact that these are roles that may fall on one same person, okay? So you can be an advisor to the policymaker in a given structure of government and also convey knowledge to advisors in other government structures. The sources of the information I will present today. First, I carried out a review of the literature on sharing knowledge with advisors in the various government structures I mentioned earlier. This work included studies from several Western countries. However, I did not find answers to all my questions in the literature, as often happens, and in particular, I did not find much about how to approach advisors. So to complement this, I conducted interviews with municipal public servants And by the way, I wish to thank them, the 5 of them, for contributing their time to this study. So why municipal government? Well, they are natural partners for regional health authorities. And yet, our literature review did not retrieve any study on Canadian municipalities. So the interviews were conducted with a small sample, as you can see, so definitely not a representative one. Rather, I aimed for diversity. So the interviewees worked in various areas, planning, social development, parks and recreation, and they worked also in municipalities of varying size. And interestingly, whereas the literature focused on the interactions between advisors and public health researchers, interviewees talked mostly about public health professionals. So again, a nice complementarity. This work will be published at the beginning of next year, and today I will just share a few highlights from this work because a lot of information was gathered actually, so I cannot outline everything. So we will focus on a few aspects. I would like to stress the fact that you may be another source of information today because with this work I identified trends, but there still may be variations from one context to another, and still there are gaps in the data as well. So I would like to invite you to share your experience, either of interacting with advisors or as an advisor yourself. According to the poll you answered when you registered for this webinar, several of you either are currently advisors of policymakers or held such positions in the past. So please use the chat box throughout the webinar if you wish to comment on what I say. If I miss your comments as I'm talking, I will get back to it during the question period. And that said, we are a large group today, so we will have to see how it goes in handling the chat live. But if there are too many comments or questions popping up, I may keep some for later. So I may send you a wrap-up or questions and answers after the webinar, but we will see how things go. So, for a start, who are these advisors of policymakers? Here, let's dispel the first myth, the idea that there's them, the advisors, and us, the ones conveying public health knowledge. This kind of simplification is quite common in the knowledge translation literature, especially when it deals with approaching government settings. Sometimes it's almost as if these settings were a terra incognita, you know, these unexplored lands in ancient maps of the world, populated with strange creatures. So, of course, all this deserves more nuance. In fact, what may make us think in terms of them and us is a lack of familiarity. But sometimes we're actually not so different on certain respects. So, for instance, maybe you find it difficult to approach government settings, but some advisors of policymakers actually feel the same about approaching public health structures, as expressed in this quotation by a municipal public servant. So, through his work in the field of social development, he had interactions with public health colleagues, but following a decentralization of the public health system, he is now facing new structures that are not familiar anymore. So sometimes we're actually stuck in similar situations. Now, another reason to tone down the idea of a them-us divide is that the profile of certain advisors is not miles away from ours, actually. For instance, a hallmark of public health knowledge is its connection with research. This idea that what we propose should be informed by evidence. Well, actually, a number of public servants are familiar with research, either through academic training or through past work experience. So to them, research-based knowledge is not something from outer space. That said, it is true that there are differences to overcome, especially between professionals trained in different subject areas. This came up in the literature review as well as in the interviews. So this has to be taken into account when sharing knowledge, of course. But the main message here would be that we should neither ignore nor exaggerate the differences. And note also that these past two slides were mostly about public servants. But there are other types of advisors as well. And if we think too narrowly in terms of them and us, we obscure the fact that there are actually several them. So we asked you also when you registered about your interactions with 4 types of advisors: municipal public servants, departmental public servants, advisors in ministers' offices, and advisors in the legislative branch. So to pave the way for the next section of the presentation, I would like to invite you to brainstorm here. Please use the chat box to express what differences you see between these 4 types of advisors. So this could be differences in terms of profile, in terms of the kind of work that they do. So please share your ideas in this regard. I can see that some people are starting typing. A few words, meanwhile, on your responses to the poll. We can see that the advisors you are most familiar with in terms of number are municipal public servants, then departmental public servants, and the more political advisors are less well known, but still quite a number of you have had interactions with them. So the comments we get in the chat box, okay, they work at different policy levels, right, different government levels. The amount of interaction, I guess this is to mean the amount of interaction that we may be able to have with them. The time frames, yeah, that's a good point, can be different across levels, exactly. They differ in the potential range of policy options that are available to them, yeah, based on the competence of the jurisdiction they work in. In ministers' offices, they have a specific portfolio and are usually more knowledgeable about their specific topic. That's interesting. We will get back to this idea of being a specialist, a topic specialist versus a generalist. Municipal, often generalist. Okay. Their focus and their motivations are different, exactly, pointing the difference between a political focus versus in the civil service, a more technical one. Okay, very good ideas here. Please start typing in for the group. Share your ideas. That's perfect. Meanwhile, I will just take a few minutes to clarify where advisors at the provincial or federal level of government are located in terms of structures, okay? Because in municipal governments, it's simpler. The advisors are essentially public servants, but at other levels of governments, you find several types of advisors. So here's a schematic representation of a department. In a department, there is an administrative component made of public servants. There's a hierarchy among them, so they may be more or less junior, senior, there are managers, and the most senior public servant in the department is the deputy minister. And besides that, there is a political component, the minister and his or her office. The reason why these offices exist is that governments are elected on political platforms, and a minister needs political advice as well when considering a public policy. So since public servants cannot provide that sort of advice, advisors in the minister's office exist to fulfill this function. Now, this is multiplied, of course, by the number of departments that make up the government. And at these levels of government, you also have a legislative branch. So the Parliament in Ottawa, the legislative assemblies in the provinces, and the policy advisors found there are, for the most part, partisan research staff. Depending on the jurisdictions, these staffers work either for party research offices or as personal advisors to elected members, or else both types of staffers exist, such as is the case in the House of Commons in Ottawa, for instance. And the major part of their work is to brief elected members for question periods, which is the time during which opposition parties confront the government. So their work is highly politicized. Of note, certain elected assemblies employ non-partisan research staff to support the work of parliamentary committees, that is, groups composed of a smaller number of elected members who work on a specific topic. So that's represented here in gray. However, this is not developed everywhere in Canada, so I will not elaborate on this. And what happens when non-partisan staff is lacking is that partisan research staff also have to support their members' work in parliamentary committees. And this is especially true for opposition members, because as for government members, they also have access to policy advice produced in departments. So here just to clarify the different types of advisors. Now, I will consider a few broad features of the different types of advisors. And you will see that it echoes a lot the comments you made in the chat box. I will focus on features that matter when it comes to sharing knowledge with them. So, as some of you pointed, public servants provide technical policy advice, whereas advisors in ministers' offices and in the legislative branch provide political policy advice. So, of course, this impacts on the way they use the knowledge you may share with them. Also, in terms of profile, advisors range from topic specialists to generalists. And you're probably reading the quotation right now, which highlights the fact that in the legislative branch, the context itself is generalist. So in some instances, topic areas are distributed among research staff, but still, each of them covers a pretty large spectrum of topics. In ministers' offices, advisors are sort of in an intermediary position because most of the time they are not topic specialists when they start, but that said, their work remains within the boundaries of the department's mandate. And in departments and municipalities, you can find a range of profiles. So among departmental public servants, for instance, you'll also find generalists, higher in the hierarchy, because such positions require having a broader view of the department's action. And as far as municipalities are concerned, well, the smaller a municipality is, the most public servants are generalists, because each of them is responsible for several topic areas. Depending on, this will have implications to be considered when sharing knowledge. First, whom should you target? So should it be a topic specialist or should it be a generalist? In instances, it may be relevant. For instance, if the knowledge you wish to share suggests coordinated action from several departmental units or even from several departments, well, it may be relevant to approach advisors with a generalist profile who may have broader views on policy issues. And besides that, of course, you should tailor how you explain things based on the profile of the advisor you are addressing. Another feature is whether the position of the advisor depends on the policymaker. So it's a yes for political advisors. It's a no for public servants. They can outlast policymakers' terms, and I will actually get back to this idea later in the webinar. So here the question is, in which time frame can outcomes be expected following your sharing of advice with the advisor? Because if it may not presumably happen during a policymaker's term, well, you should ask yourself whether political advisors are the right persons to target. Another important feature, how close are the advisors to the policymakers? This varies based on how hierarchical a government structure is. So most departmental public servants never get to interact directly with the minister because departments are huge organizations, so the hierarchical structure is strong there. So yes, that's it. At the level of municipal governments, it depends on the size of the municipality, of course, but the hierarchical structure may be less, may weigh a bit less. So normally, senior management there is supposed to handle interactions with elected officials, but all the public servants I interviewed at the municipal level mentioned that they also had such interactions themselves. And this happens even more often in smaller municipalities. As far as political advisors are concerned, well, they are part of small teams. For instance, in Canada, usually you won't find more than a dozen staffers in the minister's office. So here they are very close to the policymaker. So the question here, if you address a certain advisor, is how much weight will his or her opinion carry to the policymaker, and also how many intermediaries will there be before the knowledge eventually gets conveyed to the policymaker. So with these broad features, well, you should think of them if you get a random opportunity to interact with an advisor. So try to understand where he or she stands in terms of these features and what implications that might have in terms of sharing knowledge. Now, if you are taking the initiative and want to plan whom to approach, here are a few tips. Well, the first thing to ask yourself is which government level or levels is responsible for the policy area that is of interest to you. So if it's at the municipal level, well, there you will face only municipal public servants. But at the provincial or federal levels, there are several types of advisors. So which type should you try to address? Usually, the public health knowledge we share is technical, not political, which makes public servants in the relevant departments our most natural contact. And moreover, in Canada, it is relevant to approach departments first because the executive branch weighs more in determining policy directions than the legislative branch. But that said, you could wonder whether you should approach advisors in the minister's office instead of public servants. So here I must say that I did not find much data on these advisors, but it seems that on the one hand, they have an advantage of the public servants because they are closer to the minister and their opinion may weigh more, as implicit in the quotation presented here. On the other hand, they seem to be less accessible, so for instance, less open than public servants to being approached by researchers or experts that they do not know, and they may also use the knowledge that you share for political goals. So you have to wonder whether you can live with that. Now, if you try to approach advisors in departments and the knowledge you shared was turned down, one option would be to reach out to research staff of opposition parties. The goal here would be mainly to generate debate and maybe prepare the ground for the future. That is, if the knowledge you share influences the platform of a party that may come to power in the future. Note that if the knowledge you share is used in that context, it will be to confront the government. So again, ask yourself if you can live with that or if your organization can live with that. Okay, once you have targeted a government structure and a type of advisor, it's not over, because then you will have to identify who exactly works on your topic and contributes to policy development. And beware that sometimes there may be several answers. So here is an example given by a municipal planner I interviewed. And she suggested that public health professionals who want to advocate for better developed pedestrian networks should not only approach a city's planning department who sets the strategic orientations in terms of planning, but that they should also approach engineers in the public works department, because that's where spending decisions are actually made. So work on both fronts. So the main question here is how to understand who does what in the government structure. So here I will present tips shared by the municipal public servants I interviewed. Some of the advice they gave may apply to departments also somehow. So they really said that your starting point should be the municipal website or department website. You should look for the organizational chart, because that's how you will start identifying how the work is split between units. And then you could browse the web pages outlining the work of relevant units. On some websites, but not all of them, you may find a staff directory, so that's where you will find the contact information for the professionals you would want to reach out to. And municipal websites are very rich because they also make public the minutes of council meetings. So if you want to approach a municipal government, really study these minutes to understand what kinds of decisions are made, how they are made, which units tend to be involved. To get back to our example with planning department, public works department, well, you may identify in minutes how they are involved and at which points in the decision-making process. And by the way, this advice also applies to legislative assemblies websites. That's where you can follow the bills currently under study, the work of parliamentary committees, identify the members of such committees, etc. And another tip would be to check for events organized by a municipality. You could attend such events to learn more about their work and possibly to make connections with city staff. In the same spirit, if the advisors you wish to approach are members of a professional association, you may attend the local public events held by that association. And then you should, you could ask guidance from people. So a public health colleague who already has contacts, a public servant with whom you may have an informal connection, even a unit director, because sometimes they are the only staff whose contact information is on the website. So you can contact them so they can redirect you to the relevant person in their team. And once you have made contact with an advisor, it's important to ask questions to complement your understanding of how that government structure works, because it's not easy. Really, even the interviewees acknowledge that. So ask questions. Now, as I said, this was mostly, these were tips shared by municipal public servants. So if you have other tips to share about how to reach out to advisors in departments, in ministers' offices, or in the legislative branch, again, I invite you to use the chat box to share these topics with the colleagues. Meanwhile, I may take some comments or questions that you posted. Meanwhile, okay, I'm just getting back to the differences you identified between the types of advisors. So, yeah, differences again between political advisors as you move up the chain versus technical ones. Also, someone pointed to different perspectives, again, evidence-based versus political decisions. Okay, so no tips to share about how to understand who does what. It's fine. Let's, if you have ideas, just share them as I continue. I would also invite your questions, if you have questions so far, before we move to the second part of the webinar. So I can see that some people are typing. Okay, no. Okay, not sure. I will continue, and we will have a question period at the end. Okay. A comment came in. When you sit on joint committees across departments, okay, sitting on joint committees, yeah. Health authorities and agencies, well, that's where you can make useful connections as well. That's a good point. I will get back to this later. When invitations come to you, you really have to accept them. It's really try to set a foot in the door, and then, yes, you can start making connections. Okay, that's a great tip. So if you have more, just type them in the chat box, and I will get back to this later. Okay, just a moment ago, I discussed whom to approach among advisors. But let's take a step back, because one may think, well, let's go straight to the policymaker to share knowledge. It will be more effective. There are relevant reasons to do so. Of course, the policymaker is the one who has the final say, well, at least at his or her level. And you may also want to get around the information filters that advisors can be in practice, because they may either discard the knowledge you shared or transform it before it actually reaches the policymaker. So because of this, you may prefer to go direct. But the real question is, can you actually bypass advisors? Because as evidenced in that quotation, they are part of the system and of the process as well. So, reasons for approaching them. Some reasons belong to realism. They are more accessible than the policymaker. Well, at least most types of advisors are. For instance, in the interviews, all the municipal public servants said that they are frequently approached by citizens, by organizations, by colleagues from other municipalities. So they are used to this. And the fact of you approaching them will not be odd. Also note that hierarchy matters on both sides most of the time. So yes, I did find instances in the literature of researchers meeting ministers, but well, these were distinguished researchers, and plus researchers themselves are not part of a hierarchical structure. But on the other hand, in the interviews with municipal civil servants, it was clear that there is staff-to-staff contact And besides that, there is contact at the top of the organization. So as a professional, if you're a professional, you will reach out to your counterpart. Relevant reasons for approaching advisors, well, they process the knowledge that feeds into public policy development, as said before. Also, they are in a better position than you to speak to the policymaker because they have an insider's perspective on the priorities their organization is facing, is having, the issues, what the decision-making process are, and when to present knowledge to feed into the processes. And in most cases, the policymaker trusts them more. And contrary to you, they have more than one opportunity. So really in a better position. Other reasons that apply more to public servants, they sometimes are looking for allies. So they may need external voices to reinforce a message as shown in this quotation. So here in the quotation you have departmental public servants looking for researchers to help them make a point to the minister. And in exchange of that, the advisors can share with you useful internal information, for instance, about windows of opportunity that may arise. So that's interesting. Another point, as I said earlier, policymakers come and go while public servants remain. So this leads, in this quotation, you can see the frustration of these Canadian policymakers saying, well, eventually they'll win because they'll be there forever. Of course, it might be a bit of an exaggeration, but still, it is true that public servants are the ones who plan the implementation of public policies. So this gives them some influence. And also, on a more positive note, they could also keep ideas in store until the context becomes more favorable. So, interesting reasons to reach out to them. So, should we approach policymakers or their advisors? Well, it's not an either-or case. Even if the goal is to meet with a policymaker, and most probably it will be your senior management meeting with a policymaker, well, think of advisors as a gateway, so prepare the meeting with them to make the most of it. And also, in the case of public servants, think that maybe there could be an escape route if you have no success with the policymaker. And this is why it is important to understand their position with regards to the knowledge you want to share. So I will just pause here to come back to other suggestions that were made. Okay, Corinne submitted a tricky question. I will keep it for the end of the webinar. She asked, there are times when you just can't get policy advisors to see your issue as important. What advice would you have them? I will keep that for later, and well, I can say I don't have a silver bullet for that, but some ideas. So let's keep that. Other comments. Rose. So Barb Medlar is commenting that sometimes reaching an advisor's attention is a matter of timing. Be aware of the topics of conversation in the news, releases from official sites, and use their words back to them. That's very relevant. So the news and websites, it's important to regularly check them. And the familiarity makes them feel you understand where they are coming from. That's a very, very good point, and I will actually come back to this in the last section of this webinar. Someone pointed, well, it's a bit the same, the idea of policy windows opening, so you can you can see them coming by staying tuned on the news, on official websites, and be aware of election years. That's, yeah. You sometimes offer an opportune time to present your information. Absolutely. Very good tip. Thanks to the group. So, the final portion of this webinar, and this part, how to approach advisors, this is based almost exclusively on the interviews with municipal public servants. So one myth here, easy to dispel, I must say, I send my paper and I'm done. Well, the answer, as evidenced in that quotation, is not. It is not a one-time thing. So if you are aiming for outcomes in terms of policy development or policy revision, you will have to dedicate time to it. So you will need persistence to open up the conversation with an advisor. First, even to make contact. So in the interviews, well, several of the public servants suggested to follow up if your first email remained unanswered, because they may simply not have had the time to look at it. So follow up. Then you will need time to convince, well, first the advisor, and especially if the knowledge that you share implies adding a new item onto the policy agenda versus informing policies that they are already considering to develop. Then, once the conversation is open, your job does not stop because the advisors may need your support. They will need to convince their senior management, elected officials, and even the community. So, for instance, one interviewee mentioned the case of opening supervised injection services on the municipality's territory. And this topic came back in the news just yesterday because the new federal government is considering to review legislation on this topic. So in that case that this municipal public servant mentioned, it had been an initiative from the regional health authority, and it had taken years before the city said yes, but it finally happened. And then this interviewee explained how through numerous conversations, the public health professional in charge of the project had helped him develop the rationale that was later used by the city to make the case for supervised injection services in front of reluctant local residents. So they may need your help up till there. They also actually may need your support to implement certain policies, especially in smaller towns. So that's another example from another interviewee. He explained that the regional health authority had advocated for healthier options at the concession, at the municipal arena. And the municipality agreed on the principle, but there was very little staff and they needed help with implementation. So as this interviewee mentioned, well, tell us which healthcare items exactly we should offer, which suppliers which we should turn to, give us material to promote the healthcare items, etc. So be prepared to offer support through several stages of a policy's life. And also, as I pointed earlier, and as some among you suggested, well, the conversation works both ways. So also accept invitations coming from a department, coming from a municipality when they wish to launch a consultation or where they organize coordination meetings among organizations working on the same topic. Key features that emerged from what the interviewees said, the relationships. It was clear that knowledge sharing happens mostly in person. So they suggested that you approach them first with an email because the written form bears more weight. But past this first contact, they need to meet in person or at least over the phone, because this is how they get a better idea of who you are, and this is how trust builds. So Personal relationships matter a lot, but besides that, as mentioned earlier, it is also about relationships between organizations. So as soon as it becomes relevant, be ready to mobilize senior management in your organization so they can address their counterparts in the government structure. And the other key feature is time. It's through repeated informal contacts over time that both parties get a growing understanding of common interests they may have. It's how trust builds, and sometimes it can open the way to more formalized partnerships. For instance, one interviewee explained that after several years of well, let's say, smaller collaborations with colleagues from the regional health authority, well, she was advocating internally so that the regional health authority be given a more official role in the city's decision-making processes in the field of planning. So it can end up this way building on informal contacts developed over time. Now, note that these considerations were made by public servants. We may assume that advisors in a minister's office or in the legislative branch would not give that much importance to developing relationships over time because they work on shorter time frames. Okay, so it depends again on the type of advisor you are trying to reach out to. Now, here's the last myth I would like to discuss today, or rather, it's a debate, to be fair. And I would like you to vote. Do you agree that we must translate our knowledge into policy recommendations? So what's your opinion on this? Should we do it or not? Oh, it's interesting. So the vote is pretty mixed. I will wait a minute for more votes coming in. Okay, the yes is getting more votes, and we have comments as well. So someone is commenting yes, but only if the knowledge is appropriate. Okay, maybe when we discuss more on this topic, we will see how this makes sense. Other people are trying, wishing to comment their votes. Yeah, I apologize for obliging you to take such a strong stance on this issue. Of course, it's not that simple. So more people commenting. If it is important, we need to make strong recommendations. Okay. Policy changes, move the stick forward. Yeah, that's another way of viewing things. Yes, and also they don't know how to move into action. That's interesting. Okay, please, if you wish, keep commenting on this. I will go forward. The question is, okay, whose job is it? Because it's the responsibility of advisors to produce policy recommendations. Some actually view it as their preserve, but most of them less so. So they expect some level of effort by knowledge conveyors. But of course, there's an obvious tension here, because as a knowledge conveyor, you are better positioned to explain the knowledge being presented and make the case for it. But on the other hand, the policy advisor is better positioned to put it into context, into policy context. So the ideal would be a dialogue. So yourself for such a dialogue, or even if there's no openness for dialogue, how do you do to produce recommendations that may not be perfectly applicable, but at least that are relevant enough for advisors to consider them? So the first tip given here by interviewees is that you should study thoroughly the existing policies in your field and their implementation too. By this, we mean bylaws, regulations, guidelines, standards, even simply existing programs. These tools matter because it's through them that policies actually get put into action. So how do you do that? Well, most of the tips we shared about how to understand who does what also apply here. And again, that's the beauty of a dialogue when it can happen. Ask questions also from the advisor you are reaching out to. So, and based on this, one thing to do will be to highlight the common objectives. I think what someone in the comments raised that point already. So again, with the aim of making sure that your recommendations get considered, highlight the common objectives. That's a way of saying, oh, we see that you care about health, and so do we, so here's how you could go further. But also, of course, you are sharing knowledge for a reason, because you feel that some things need improvement. And the advice of municipal public servants here is to point precisely what should be changed. So as she says here in the quotation, it's constructive when experts come with an understanding of what are the pieces that need to be fixed, rather than just talking about principles. So that's important. Another constructing thing to do is to show examples from elsewhere. So similar policies in similar jurisdictions. The interviewees mentioned how such examples helped or may help develop policies in their own jurisdiction on topics as diverse as, again, supervised injection services, design guidelines to promote active transport modes, or municipal standards for cell towers. So really, it's useful. Of course, examples are more relevant if they are from similar jurisdictions, especially if they are of a similar size, and details are useful in terms of how the case was made, how the policy is implemented, etc. So that was really a sneak peek into the work we have conducted. As I said, there will be much more detail and other topics explored in the documents that will be published at the beginning of next year. If you want to be informed when these documents are published, you can subscribe to our distribution list. There's a path here, but we will also send you an email after the webinar, which will include the link to access the subscription form. So now I will ask for your questions and comments. I will get back to some questions or comments you made earlier. So, first, comments. I think that was about should we produce recommendations or not. So, Caroline said that sharing implications of the knowledge is always relevant. Moving to policy recommendations is another step. Can be, but is not always relevant. That's a good point. It could be thought of as a two-step process, because even if we produce and present policy recommendations, ideally they should not be put forward as a definitive stance. It's more a way to open a dialogue, to share a contribution and show that we are open to discussing this with people who have an insider's perspective. That's a comment that was made by Nancy, because it's difficult being an outsider to make sound recommendations, and that's when dialogue gets useful, at least when there's openness for that dialogue. So questions we had. Yes, a comment that Corinne made earlier. So there are times when you just can't get policy advisors to see your issue as important. What advice would you have then? Okay, we talked today, well, with the idea of addressing advisors is there's the fact that sometimes the responsibility for a topic is shared among several advisors. So you can always try another advisor. If it does not work, you could still try with another type of advisor. We mentioned, well, reaching out to public servants,